Part 2 will focus on the scanning in the parasagittal plane. Before we go any further, I want to do a quick review on some vocabulary or terminology. And the reason for this terminology is because under ultrasound is oftentimes difficult to visualize different structures separately. Oftentimes they kind of group together. So posterior complex, that refer to the structure over here, the ligamentum flavum and the posterior dura. The anterior complex is going to include your anterior dura, posterior longitudinal ligament, and the vertebral body. So keep that in mind when we talk about sonar anatomy later. So there will be 5 views that we'll talk about today. First, we're gonna go over the sagittal plane. There's gonna be 3 views, and different view look at different structure, as you can see. And the one I color in red are the parasagittal oblique and the transverse interlaminar. These two are the most important view, and we'll explain why in the next couple slides. So let's first talk about the parasagittal transverse process view. So here we're looking at the transverse process, specifically multiple transverse process in a row, and what that translates to a 2D ultrasound image is this pattern right here. What we call a trident sign. So these hyperechoic structure, the transverse process, together they form a trident sign. This view is not super helpful, but it's still good to know so that way you can know where you are. Next one is slightly more helpful, and the reason is this is a stepping stone for you to obtain your parasagittal oblique. So here we slide the transducer medially to one midline, not at the midline, but we stop at the articular process. So we're looking at the superior articular process and inferior articular process. Together they create the facet joint, and the ultrasound image for this view going to be this structure right here. This is what we call the camel hump, and we see these hyperechoic structure is the articular process, and as you can see the shape of it give it the name the camel hump. Now after you have the articular process view, what you need to do is tilt to one midline to look into the spinal canal. Okay, so here the yellow line is the the articular process, and now we tilt midline. The red gonna be the parasagittal oblique view, and now we look into the spinal canal. And this is going to be the ultrasound image pattern that we're going to have. This structure right here are your lamina, and the superficial line, I know they label here as the dura, but realistically it's the posterior complex, because it's very hard to see the dura and the ligamentum flavum separately. Oftentimes you see them combined together, and we'll just refer to them as posterior complex. The deeper structure here is going to be your anterior complex. So let's look at the image with some labeling. Here's your lamina. Here's your posterior complex, anterior complex, and the space in the middle, that's your interspace. So look at another picture here. This one has less labeling, so you can have a more realistic view of what it actually looks like. Again, this hyperechoic structure is your lamina. The more superficial line is your posterior complex, and the deeper structure here is your anterior complex. So why this view is important? First, now because you can visualize your posterior complex, and remember your posterior complex is the combination between your ligamentum flavum and your posterior dura. So you can measure the distance, and that tell you how many centimeters to get to the ligamentum flavum. Important for your epidural placement. Also, in this view, you're gonna mark your interspace as well. So what you need to do is maintain the same oblique view, but slide caudally or downward. and find your L5 S1 view. So remember, the gap in between your laminar is your interspace. So you want to center them in the middle of the screen and use the middle line on your transducer and to mark your level. As you see over here, in this picture over here, we mark several level. That way you have multiple different multiple option for your interspace level.